friends. My name is Vivian Zatola, and I wanted to share with you just a very brief, I'm going to try to keep it under 10 minutes, short presentation on the services that I offer. I want to start off with, I'm going to talk about the effects of dog training and from a 30,000 foot view, dog training, the type of training, as well as professionals that you can seek out. And it can become a little confusing because there are multiple professionals that can help you, some of which collaborate, so that getting to the right professional is very, very important. And then I'll go over my service that I offer. If you'd like more information about me, please visit clicktherapyfordogs.com. You may also visit dog behavior and consulting services.com or bostonk9concierge.com. Certainly, if you want to call me, I can be reached at 617-721-8025. I am an applied anthrozoologist. I have a master's of science in anthrozoology, which is the study of humans and animals and relations between humans and animals, particularly focusing on ethology, psychology, the psychology of human-animal relations, as well as ethics and welfare. I specialize in canine behavior, and I came from the training world up through the training world into behavior specialty. Small animal clinical medicine is something that I've studied with the help of some wonderful teachers, Dr. Overall and Dr. Dodman. I am presently working as a volunteer research associate and a subject matter expert with the Center for Canine Behavior Studies. More information about our group, it's a nonprofit, and we study human-animal relations and work on trying to get the information that we learn out to the public so that relationships are improved, and our aim is to reduce the number of surrenders. And so that group is headed by Dr. Nicholas Dodman, who is a veterinary behaviorist. I'm an animal advocate, and I have learned so much about myself and humans in general by learning more about non-human animals. So it's been a wonderful journey for me so far. I'm a daughter, I'm a caretaker for my mom. We live together, my husband and I take care of her. I'm, a wife, a sister, a stepmother, niece and an auntie. So I just wanted to just share that who I am in a little bit of a couple of words. But like you, I wear many hats, and life can become very busy. And I live with 3 dogs, Jimmy Choo and Stella, 16-year-old geriatrics, as well as George, who's a senior, and a kitty, Nino. And so helping their responsibility for me, I took on that responsibility, and I take that seriously, as anyone should. What often happens is that we take on responsibilities. Sometimes we're overwhelmed, and something might break as a result. And so it's important that if we can, we do, and if we can't, we help and in this case, dogs. If we can take care of them, we do it well. And if we cannot, then we should, in all fairness, maybe move the animal on to someone who may be able to take care of them in better. And that's a hard decision to make, but that's an important decision to make. And that brings me to the next slide, which is a 30,000-foot view of the welfare effect of dog training, but also our relationship with our dogs and living with our dogs, right? So we want to ensure that we're giving them the best life possible and ensuring that their basic needs and their basic needs are met, but also that we're managing expectations. And we do that through training, dog training. Dog training is just it is about teaching, right? So dog training is really teaching our dogs and managing our dogs. And learning how to do that is critical. Just the same, a good analogy is with children. It is important that we teach our nonverbal children with kindness. We should do the same with our nonverbal friends, furry friends that we live with, whether it's a cat or a dog, a horse or a rabbit, pet companion. So this schematic comes from a variety of different literature that I've read over the years, and I wanted to look at the distribution of the dog. And unfortunately, our pet companions are commodities. We buy and sell them, which is what causes a lot of problems. Relationships break down, and for whatever reason, people get ill, people pass on. There are so many reasons that dogs are relinquished. Some of them are surrendered because of poor behavior, bad behavior, possibly brought on because the animal wasn't exposed to the life they were going to be living, possibly brought on because they were taught using training methods that included fear and pain and intimidation, and so the bond broke. So it does matter what type of training. There are just two types of training. There's punitive training and there's kind training. That's it. There's no in the middle. We're either using kindness or not. And I'm not going to get into the science. However, what is important here is that no matter where the animal comes from, whether it's a commercial breeder, a rescue, found on the street, sold in a store, the veterinarian is the professional who will see the animal and be the first contact, and often have contact with the owner, legal owner, guardian, for the life of the pet, or at least for the life of the relationship. And so it's incumbent on the veterinarian to help direct the owner, the guardian, especially when there are challenges. Oftentimes, though, the care of our pets, the practice of caring for our pets has changed over the years, and now more and more clinics, veterinary clinics, are using the same human-centric style or model off of what's used in medical care with humans. So this care of treating the non-human animal like an individual, right? And recognizing that they are emotional beings. I mean, the literature is there, and we're finally it's finally catching up with veterinarians, and it's being practiced. And that came about from some work that a pioneer, Dr. Sophia Yen, years ago started. She actually bridged veterinary care and training, right? She's a veterinary behaviorist, and she bridged the two. She unfortunately passed on, and Dr. Marty Becker took the reins and has run beautifully with it. And the pet, Fear-Free Pets is now 66,000 members strong, maybe a little bit more. And so it's a wonderful tool to use in learning more about our animals, and more clinics, groomers and trainers are learning about fear-free methods in handling animals, which is really important and makes the difference. As important is that veterinarians are now, instead of just giving people information about trainers in general, they are looking to refer behavior trainers, qualified trainers, specifically using non-punitive methods, right? So reward-based, you may have heard of reward-based methods, or emotional trainers that are focusing on helping to change and improve behaviors based on the individual learning through their own likes and dislikes, right, rather than forcing. So that's been a breakthrough in the past few years. What's critical here is to know that if your pet suddenly behaves strangely, it's really imperative that you seek the help of a veterinarian. And so there might be an underlying medical condition that's going on. So if you see something strange, call your vet and have your pet looked at. Throughout a dog's life stage, or a cat's life stage, or a horse's life stage, there are many developmental phases. And so a puppy, for example, and a senior might sleep longer, right? Or you might see that a puppy will chew, or a kitty will chew because they're teething. And so that's normal, that's natural. Teething is one reason that our pets chew, but also teething could be could happen when they're older. I mean, not teething, but actually their molars come in a little bit older, but they might want to chew when they're older, as an adult, and that might be as a result of distress. So determining whether it's something physiological or psychological is something that your veterinarian can help you with. That said, there are also qualified trainers and behavior consultants that can assist you with that as well. So if once your veterinarian has reviewed looked at your animal, your pet, and determined that there's nothing physical, then you might want to work with one of their referred qualified trainers or certified behavior consultants. What's really important about this slide here is that we're all working together. So a veterinarian may refer you to a consultant, and we are all collaborating in the care of your pet, and you're an integral part of that care as well. Some veterinarians are not as versed as others in behavior medicine, and so they may want to collaborate with a veterinary behaviorist. There's not many veterinary behaviorists. I want you to think of the veterinary behaviorist as a psychiatrist. There's about less than 100 in the United States. However, many do consult with veterinarians. We are seeing a surge in behaviors because of COVID, so the need to collaborate is a little bit more demanding now. So please feel free to speak with your veterinarian if there's a behavior issue, and you can certainly have a behavior consultant evaluate your pet as well and escalate if necessary. But it's not uncommon for veterinary behaviorists to collaborate with veterinarians. So the other thing that I wanted to note here is the certified applied animal behaviorist. They are behaviorists like a veterinary behaviorist. However, the difference is that the certified applied animal behaviorist cannot prescribe medication. However, there are some CABs that are DVMs. There are some CABs that are a doctor of veterinary medicine. Point here is see your veterinarian if you have any behavior issues first, just to ensure that there are no underlying medical issues. I offer a human-animal click therapy or click therapy for dogs, and I call it click therapy for dogs. However, I want you to just think about this. So click therapy is like talk therapy for people, right? So with talk therapy, we can have a conversation, but dogs, we can't have a conversation. We need to use training to convey meaning, right? It's a bridge that allows us to manage expectations, but also help to improve behaviors. And so there are some techniques. There are many techniques that behavior trainers can teach you and impart on you, a dog owner, that are really simple for you to implement. Sometimes it's just simple managing the environment, managing things that you do, coaching yourself, watching yourself and your actions. And sometimes it's a little bit more detailed, and it is work. It's not easy, but it is something that can help. I offer a behavior modification training program. It's 90 days, 7 lessons. It starts with discovery and planning, then moves into teaching you body mechanics, the training and implementation of the training. I'm your coach, and that's integral, and that's a really important part of the training itself. You're buying my time. I'm an on-demand coach throughout the life of the engagement, and if you finish your lessons before 90 days, and that has happened, I'm still there for you. The material is there for you. It is in part an online course as well as in-person course. And I do offer a remote training as well for people that are outside of the Boston area and choose to want to work with me. So the human-animal click therapy or click therapy for dogs, and the program itself, again, is 90 days. And so we do start with discovery and planning that I will coach you through. And you're learning multiple facets of training. So it's not just sit down, come one call, loose leash walk with me, stop it, leave it, right? It is really discovering your dog's likes and dislikes. It's you're recognizing body language, mapping the body language to the environments that you can better manage your dog. It's understanding what's natural, normal for a dog, what's natural for a dog. Because oftentimes, as I mentioned earlier, it does come into our home. Dogs are dogs. They're meant to be dogs. They're dogs. They're meant to smell and forage and dig, and they have not evolved to living inside an apartment. They are adapting. They are trying to adapt, but they're not there. So oftentimes we will ask more of them than they're ready for. So it's learning how we interact with our dog, as well as planning. So we're planning not just the training, but it's also planning for ourselves as too. Because if we're not taking care of ourselves, then we're not able to take care of our pets. So that's going to be really important as well. And then, of course, it's the body mechanics. So we'll be going over training. We'll be staying in touch every week, daily if you need to. I'm your coach and I'm there as needed. When I talk about body mechanics, I'm specifically talking about capturing behavior, luring behavior, and asking for behavior. So those are the three techniques that you learn. And operant skills is just a fancy word for teaching your words, meaning they're words that are actionable words. Because if you think of sit down, come and call, drop it, leave it, they're just verbs, right? They're just words. They're not commands. We're asking our dog to do something, right? And so when we ask, we're not overlooking the dog and their personal and unique perspective of the world. But when we think of commanding an animal to do something or an individual to do something, right? When we command it, then we overlook things that might be happening in their world that they perceive that might be frightening, right? That's why I like to call it an ask. So learning when you should capture versus when you should lure versus when you should ask. And I help you with that. And this is my little friend who's all excited because his humans are learning. So I hope that was helpful. Thank you very much for watching. Again, if you have any questions, please feel free to call me at 617-721-8025. You can direct message me at Vivian Zatola Dog Behavior on Instagram. And you can visit my website, clicktherapyfordogs.com. Thank you again. Bye-bye.